everyone, welcome to my YouTube channel. I am going to upload the whole syllabus of anatomy including upper limb, lower limb, thorax, abdomen, pelvis as well as CNS. So my today's topic is anterior tibial artery. I have already started with the lower limb session. We will be learning this artery into three subtopics, that is its beginning, course and termination, its relation and branches. So introduction. Main artery of anterior compartment of leg. It is the main artery of the anterior compartment of leg. Anterior tibial artery is the smaller terminal branch of popliteal artery. It begins on the back of leg at lower border of popliteus muscle opposite to tibial tuberosity. It enters anterior compartment of leg by passing close to the fibula through an opening in the upper part of the interosseous membrane. In anterior compartment, it runs vertically downwards to a point midway between two malleoli, where it changes its name to become Dorsalis Pedis artery. We can understand with the help of the diagram. It is a terminal branch of popliteal artery, where it begins at the lower border of popliteus muscle opposite to the tibial tuberosity. This is the tibial tuberosity, opposite to the tibial tuberosity. Then it enters the anterior compartment of leg by passing close to the fibula bone through an opening in the upper part of interosseous membrane. फिर in anterior compartment it runs vertically downwards, point midway between two malleoli, where it changes its name and became Dorsalis Pedis artery. Till here it remains anterior tibial artery between the two malleoli, then it becomes Dorsalis Pedis artery. Its relation: in upper 1/3 it lies between tibialis and anterior, tibialis anterior and extensor digitorum longus. In middle 1/3 between tibialis anterior and extensor hallucis longus, lower 1/3 extensor hallucis longus and extensor digitorum longus. So upper 1/3 tibialis anterior is in both upper 1/3 also and the middle 1/3 also. In upper 1/3 that is extensor digitorum longus, and here it is extensor hallucis longus in middle one. Then in lower 1/3 extensor digitorum longus and extensor hallucis longus is present. There is no tibialis anterior. So like this you can remember. Deep peroneal nerve is lateral in the upper and the lower third and anterior in the middle third. See, the deep peroneal nerve, it is lateral in the upper 1/3, it is lateral in the lower 1/3, but it is anterior in the middle 1/3. Its branches: it has muscular branches which supply the adjacent muscle, anastomotic branches which supply the knee and the ankle, anterior and posterior tibial recurrent branches which take part in anastomosis around the knee joint. The anterior medial malleolar and anterior lateral malleolar branches which take parts in anastomosis around the ankle joint. Anterior lateral malleolar and anterior medial malleolar, these both. Lateral malleolar network lies below the lateral malleolus. Below the lateral malleolus, medial malleolar network lies below the medial malleolus. So this was all about the anterior tibial artery. I hope you understood the topic. If you want such more videos, you can subscribe to my channel, and if there any query, please do comment in the comment section. Thank you so much.